Sucralfate syrup forms a protective layer on the surface of the ulcer, preventing the damaging effects of hydrochloric acid, pepsin, and bile acids. Indications: peptic ulcer of the stomach and duodenum in the acute phase, symptomatic ulcers, stress ulcers of the gastrointestinal tract, erosive and ulcerative lesions of the gastrointestinal tract associated with taking NSAIDs, hyperacid gastritis, reflux esophagitis, reflux gastritis, gastroduodenitis, heartburn, medicinal ulcer, hyperphosphatemia in uremia patients on hemodialysis. How to use: shake the bottle well before each dose. Take this medicine by mouth, usually 2 teaspoonfuls 4 times daily, on an empty stomach at least 1 hour before a meal, or as directed by a doctor. The dosage is based on a medical condition and response to therapy. For all dosage form suspension to treat duodenal ulcers, adults 1 gram, 10 ml 4 times a day, taken on an empty stomach for 4 to 8 weeks. Children use and dose must be determined by a doctor. Contraindications: hypersensitivity, dysphagia or intestinal obstruction, bleeding from the gastrointestinal tract, chronic renal failure, children age up to 4 years. Use during pregnancy and lactation with caution. Special instructions: patients with renal insufficiency should monitor the concentration of aluminum and phosphate in the blood serum. The use of the drug in seriously ill patients, prevention of stress ulcers, reduces the risk of developing pneumonia and in general death. Efficacy in functional dyspepsia: overall efficacy, speed on onset of effect, improvement in quality of life, incomparable to the placebo effect. Side effects: from the digestive system, constipation, diarrhea, nausea, dry mouth, gastralgia. From the side of the central nervous system, drowsiness, dizziness, headache. Dermatological reactions: pruritus, rash, urticaria, other pain in the lumbar region.